Dr. Desmond, and welcome to the GI Health Summit. Thanks so much for taking the time to talk to me today.
AJ, thanks for making me part of it. Just delighted to be here.
Well, it wouldn't be GI Health without you, believe me.
Oh, that's really kind.
So, Dr. Desmond, we've had a lot of experts on this summit talk about various GI diseases, a lot of SIBO and IBS, but there's one disease that really hasn't been discussed, and that is Crohn's disease. Can you talk a little bit about it?
Yeah, so Crohn's disease. What is Crohn's disease? Well, AJ, Crohn's is one particular form of a group of conditions called inflammatory bowel diseases. With patients with Crohn's disease, unfortunately, have parts of their digestive tract which have chronic inflammation. And when we look at them with our colonoscope or through X-rays or MRI scans, we can see that there are sections of their bowel that are being attacked by damaging inflammation. So it's red and it's sore. I mean, a nice healthy bowel lining looks a little bit like the lining inside your cheek, pink and smooth and healthy and functional. But with Crohn's disease, you get these sections that just look ulcerated and damaged. And as you can imagine, having a section of your bowel that is ulcerated and damaged and unhealthy causes significant symptoms which have a really significant impact on your quality of life. So if you've got this condition, you're going to know about it. Unless you have it in one of its very mildest forms, people may be experiencing symptoms like chronic diarrhea or weight loss. They may have unpleasant infections and abscesses around their bottom end. They may be losing weight. And once that diagnosis has been made, we know that about 38% of people with Crohn's disease are regularly absent from work due to illness. About 2/3 of kids with Crohn's disease are regularly absent from school because of illness. And only about 1/4 of people with this diagnosis would describe themselves as being in excellent or good health. So it has a real impact. And I've just described a very unpleasant, lifelong condition involving chronic inflammation of the gut. And incredibly, this condition probably affects about 1 in 200 people right now in the US, the UK, and other high-income countries.
I didn't realize that even children suffered with this. So what is causing this chronic inflammation in the gut, and what can we do about it?
Well, when I was in medical school, we were taught that, like all chronic diseases, that this was predominantly a genetic problem, that there was something wrong with a patient's genes that gotten bad genetics from their parents, and therefore their immune system was offline and was attacking their gut. There was nothing we could do about it. But we have lots of medications to suppress the inflammation, and that's what we can do about it. But in fact, that, like so many chronic diseases, we now know that your destiny isn't set in stone, that genetics actually don't have that much to do with getting this condition. A couple of years ago, about 4 years ago now, in the Lancet Medical Journal, one of the most prestigious medical journals in the world, a group called the IBD Genetics Consortium. This was a huge collaborative effort. They included 30,000 patients with inflammatory bowel disease from 16 countries across the globe. And they did like a detailed genetic analysis. And they did find that there are some genes that can kind of predispose to getting this disease, but they don't definitely mean you're going to get the disease. And if you get the disease, they do not define at all how severe your disease is going to be. And what was a real eye-opener for me 4 years ago was when this paper was published in the Lancet. And this is an incredibly detailed body of work that took years to complete. It's incredibly academic with cutting-edge genetic techniques involved. I mean, to recruit 30,000 people around the globe and do full genetic analysis, this was a big scientific effort. But even in that paper, the geneticists who wrote the paper and wrote the discussion commented in that paper that the genetic variants described here have a small effect on this disease. Environmental factors, including diet, are more important. And we now comprehend that Crohn's disease is much more of a multifactorial disease. That yes, genetic susceptibility has something to do with it, but environmental triggers like diet are so important. How your immune system interacts with the contents of your gut and your gut microbiome is so important. And the food, which is what we're here to talk to you about today, the food that you put into your digestive system is really, really important in patients with Crohn's disease, both in eating healthily to prevent Crohn's disease, to reduce your risk of getting Crohn's disease, and if you have Crohn's disease, helping you to achieve remission. And not to always replace medication. I prescribe these medications all the time. We've got some great medications for Crohn's disease, but these medications have their limitations. We know that one of the things that attracted me into being a doctor who treats inflammatory bowel diseases, AJ, was around the time I finished medical school in 2001, 2002. There was a lot of new drugs coming out to treat inflammatory bowel disease, these drugs called biologic drugs, like infliximab and adalimumab and ustekinumab. And in the acute setting, when we had patients with really active and bad inflammatory bowel disease, previously we would just give them lots of steroid medications to push everything down. And if the steroids didn't work, we were really in trouble, and patients would be headed for surgery to have diseased parts of their bowel removed. But around 2001, 2002, these new biologic drugs, these fancy new drugs that interact with our immune systems in a very complex way, were just starting to come out. And we were seeing patients on the ward who previously needed emergency surgery, but now we're giving them this new drugs. And it looked like the inflammation was melting away. But of course, like a lot of our miraculous modern medical therapies, what we see now is that, yeah, okay, great, they work for most people when things are red hot in that emergency setting. But when you're looking at the long term, the chronicity, when you really want to get people into sustained remission, you've got to look beyond drugs. You got to look at the whole picture.
Yeah. 1 out of 200 is fairly significant. When I think about all the people I know, I probably know at least a dozen people with Crohn's disease. And the fact that it's affecting children blows my mind, because even if children are eating poorly, it's not like they have eaten poorly their whole life.
Well, you're absolutely right. The average age at diagnosis is 30 years old. So half of the people will be younger than that when they're diagnosed. So this is a disease that when it hits, it's hitting people in their kind of, they're young people, they're in their productive years, they're often in university, or they're, starting their career or starting their family. And outwardly, they generally look, really very healthy, and they are in those kind of productive years. But when they get this condition, they have to sit down with a guy like me, or a doctor like me, who says, look, we've just diagnosed this condition called Crohn's disease. You're going to have it for the rest of your life. You're going to need to have camera tests and endoscopies and scans. You've got chronic inflammation in your gut. We've got surgery. We've got drugs. There's a 50% chance that in the next 10 years, you're going to need to have part of your diseased bowel removed. And this is devastating for people, AJ. It can be really, really devastating. And a young, healthy, vibrant person, and sometimes a child, needs to come to terms with the fact that they're going to be visiting clinic 3 times a year, 4 times a year, 5 times a year. They may be regularly in hospital. They're going to be on medication into their vein. It's a real change for people. But I know that I just mentioned, like back in 2001, when all these fancy new medications were coming out, and I was like a newly qualified doctor doing my first spin in GI rotations. Even then, I noticed that when we had that conversation with someone, when they'd been newly diagnosed with the condition, they always ask one question: what about diet, doc? Is there anything I should eat? Anything that I shouldn't eat? Any foods that can help me to heal today, but also to improve my prognosis over the next 10, 15, 20, 30, 40 years. So I need fewer medications, maybe. Maybe I'll be less likely to need an operation. And throughout my career, I've been looking to provide my patients with evidence-based answer to that question too. So I've got the right medication. I know when to refer for surgery. I know how to make the diagnosis. But when the patient says to me, what about diet, doc? I think as doctors, we have a responsibility to recognize that when people are sick, we've got to use every tool in the box. And diet is in there just alongside everything else. In many ways, it may be the best tool we've got.
Some of the experts on the summit were saying people with things like IBS, they often suffer for 14 years or more. With somebody with Crohn's, is there more immediacy? Like, do they know right away they've got something serious? How long does it normally take for them to have symptoms to get a diagnosis? And what are usually the first presenting symptoms for Crohn's disease?
It's a little bit variable, AJ, and I would think that we think that generally between the earliest inflammation and actually presenting to a doctor and reaching a diagnosis, which may require an MRI scan or a colonoscopy, etc., that there may be a 4 or 5 year lag. Often the symptoms that you can get with early Crohn's disease can, you might just pass it off as a little bit of tummy upset, or, oh, certain foods don't agree with me, or I feel a little bit bloated or a little bit uncomfortable some days, and maybe I've just got a little bit of IBS. And I'm sure some of your other speakers will have talked about the prevalence of digestive symptoms in high-income countries that eat a standard Western diet. It's like most people eating a standard Western diet have some GI upset or some indigestion or dyspepsia or bloating. So people go, oh, everybody else has got bloating, I've got bloating, we've all got bloating, it's fine, it's normal. But the thing with Crohn's disease is it can develop to pain and, diarrhea, blood in the stool, weight loss in children, failure to thrive, where kids just aren't getting taller and they're not maturing as they ought to do. Sadly, for quite a few patients, by the time they get to a diagnosis, oftentimes the inflammation in the gut have really taken hold, and they may have sections of the bowel that have already been permanently damaged.
Wow, that's incredible. And so when it's permanently damaged, then the only choice is to cut it out?
No, not necessarily. Not necessarily. I've had plenty of patients who have presented with very clinically severe disease, but who have not ended up having surgery. And I think with the right medication and the right dietary advice, we can get the majority of people into really good remission.
Yeah. It seems one of the reasons I'm doing this summit is that there seems to be so much shame and embarrassment around a lot of the GI diseases because they involve the bowel and pooping and things like that. And so people don't even go to the doctor for, like you say, they suffer for many years before they'll even go.
I know, it's such a shame, AJ. I've often said to people before, if we could just destigmatize what we do when we sit on the toilet, then it would just be so much easier. It's like all these, when you buy the newspapers at the weekend, every single newspaper has like a Sunday supplement with recipes and restaurant reviews and everything. But it's like so we're obsessed with food, but once we've swallowed it, we don't want to talk about it. What happens afterwards? I mean, if it was normal to sit down at a family dinner with your auntie and your mom and your uncle and your friends, if it was normal to sit there and say, guys, I saw some blood in the toilet bowl today. Is that normal? And then, maybe your auntie would say, oh, well, I had hemorrhoids and I got them checked out and that's all it is. And your sister had them. And, your brother has Crohn's disease. Maybe you should get checked out. It would make my life so much easier.
Well, you showed me an adorable mug that you have, which I love so much.
The Bristol stew chart.
Right, which actually is a gift I'm giving every speaker on the summit, except for you because you're international.
I've got one.
And you already have one.
But
one of the things I want to do is like make pooping normal again. Everybody poops, but everybody's embarrassed to talk about it. Things like gas, bloating, belching. It's like,
You said it. Everybody poops. I got to get a T-shirt.
Yeah, maybe that will be your summit gift. That's terrific. What do you think, Dr. Desmond, is so bad about the standard American diet that is causing so much of these inflammatory GI conditions?
Well, there's a few things. I mean, so when we talk about the standard American, standard Western diet, or the standard British diet, the standard Australian diet, I guess maybe you guys get credit for inventing it, but it's worldwide now. So we're talking about a diet that is low in fruit, low in vegetables, low in whole grains, low in nuts, low in seeds, high in processed food, high in ultra-processed food, high in dairy fat, high in animal products, high in eggs. So, 60% of calories coming from ultra-processed foods, maybe 9% fewer calories coming from fresh fruits and vegetables. There's a few clues. So a really good clue comes from the Harvard nurses study, okay? 170,000 women followed for 26 years. What did we learn? The nurses in that study followed for 26 years. Those who ate more plants were less likely to get Crohn's disease. In fact, the nurses in that follow-up who had the highest intake of fiber were 40% less likely to ever get Crohn's disease. Interestingly, AJ, the nurses in that group with the highest fiber intake in Harvard were still only getting 26 grams a day, which is a harsh indictment of the standard Western diet. But even hitting that seems protective. We also know that the standard Western diet is associated with an increased incidence of Crohn's disease in children. Nice work out of the University of Montreal a couple of years ago showing that the kids kids who eat more fiber and fruits and vegetables are less likely in the long term to get Crohn's disease. Why is that? Well, we know fiber reduces inflammation. I'm sure some of your speakers will have been talking about the role of fiber and microbiome available carbohydrates, which our gut microbiome turns into short-chain fatty acids. They do a lot of the stuff that the drugs we use to treat this condition do, like they inhibit inflammatory mediators like NF-kappa B and all this technical stuff. But the short-chain fatty acids reduce the inflammation in our gut. So we eat fruit and vegetables, and the inflammation goes down. We know that by eating fiber, we help to maintain the integrity of our gut epithelial barrier. So it keeps the stuff that's supposed to be in the gut, and the stuff that's supposed to be under the lining, under the lining. In Crohn's disease, although we used to think that it was the immune system attacking the gut causing inflammation, it's actually the immune system attacking the gut microbiome. The damage to the lining of the gut is like collateral damage. So in patients with Crohn's disease, that important, that vital epithelial barrier has been damaged and injured, and we're getting abnormal contact between the gut microbiome and the immune system. There's this particular bacteria that seems to be prevalent in the gut microbiome of individuals with Crohn's disease. It's called adherent invasive E. coli. We don't see it in healthy individuals generally, but we see it in people with Crohn's disease. So adherent invasive. So it does exactly what it says. It adheres to the lining of the small bowel. It sticks onto the cells, gets itself transported into the body, where it triggers an abnormal immune response, resulting in damage to the gut. This shouldn't happen. But we know that if we take sections of human gut from people who have Crohn's disease, they've had surgery to remove that diseased section. If you put that section of gut in lab conditions, you can see this adherent invasive E. coli still there doing its thing, causing damage. If you expose that little setup to dietary concentrations of for soluble plant fibers like pectin from things like plantain and broccoli and banana, it reduces that process by 70%. So, the anti-inflammatory properties of fruit and vegetables, the healthy effect it has on your gut microbiome, can reduce that process by 70%. If you're not eating any fruits and vegetables, you're not going to get the benefit of that. And the very same problem with this nasty bacteria causing invading the gut and causing the inflammation leads to Crohn's disease. If you expose that system to a dietary emulsifier, the stuff that's put in ice cream, whippy, like soft whip ice cream, you'll find it in hot dogs, you'll find it in a lot of processed foods. It makes things feel creamy and delicious when they're highly processed junk food that would taste terrible otherwise. But these emulsifiers double the process. They help those nasty bacteria to stick onto the lining of the gut, to invade and trigger the immune system, to cause not just Crohn's disease, but also chronic inflammation, the promotion of the development of cancer, and also have the microbiome changes also have a role in the changes that lead to the metabolic syndrome with obesity and overweight and type 2 diabetes. And you would imagine, AJ, that given everything I've told you about Crohn's disease, that most of the patients, when they come to see us, that they'd be like emaciated and underweight, but it's just not so. The patients who are diagnosed with Crohn's disease often are carrying extra weight, they're carrying extra pounds, they got insulin resistance, they've got an increased risk of heart disease, etc. So it's sort of the same foods that are making us overweight and obese with heart disease, high cholesterol, etc. The same foods are putting us at risk of developing this dreadful bowel condition. But I just don't want to sound like I'm blaming people. There is no blame here. This is the culture that we live in. This is the food that's presented to us as convenient and clever and smart and
cheap and delicious.
And cheap and delicious. And I remember, AJ, I lived in Boston for a summer back in must have been 1998. Okay, first year away from home. I was in medical school. After 4 months, I went and lived in Boston, and I remember doing my first food shop. So my first food shop in the US, it was in Star Market in Boston. I don't know if Star Market is still around. So I went in, I had a very little budget. I was working, I was working as a house painter. I was getting, I think, like $5 an hour or something, anyway. But so I had very little money to do my food shop. I went around, did the best I could, got the kind of meals that I liked. And at home, when I was growing up, we would always have like a big bowl of fresh fruit on the kitchen table. It was always there. So I said, well, that's what I'm going to do. I'm going to put a big bowl of fresh fruit on my kitchen table. So with my shopping, I got like 6 apples and 6 oranges. And when I got to the till, I had to put them back because I couldn't afford them.
Wow.
I didn't have enough money to buy. I was on below minimum, and I just didn't have the cash to buy fruits and vegetables. But I could buy ring dings and Twinkies and, like pot noodles and instant food real easy. And that's what I lived on for the summer, like hungry man meals, that kind of stuff. But I couldn't buy fresh produce. It was incredible.
There are some people for whom that is really still a reality, that they can't afford it. But
Absolutely.
There's also some people that could afford to eat fruits and vegetables, but because of the addictive natures of these foods, choose not to.
Yep, absolutely. So there's no blame there. It's a bigger issue, isn't it? It's about accessibility and availability and education, etc. So.
Well, all the experts talked about how important fiber is, yet there's so many people that just don't eat it because there's no fiber in animal products and processed food, or they already have a GI condition and they feel that the fiber makes it worse. It causes gas and bloating and distension. And sometimes even gastroenterologists put people purposely on a low fiber diet.
Absolutely. That's something that's often used in Crohn's disease and ulcerative colitis. And I think the logic being, you've got a condition which causes you to use the bathroom frequently. So if I put you on a diet that's going to constipate you, you're done. I've fixed you. You're better, But there's no science behind it. In fact, the studies looking at the low residue, low fiber, or low plant diet, even for Crohn's disease, those studies just don't show a benefit in terms of reduced disease activity, reducing need for surgery, reducing admission to hospital. And even just a few months ago, there was a study looking at a whole food, plant-based, low-fat dietary intervention for patients with ulcerative colitis, which is very closely related to Crohn's disease. And this is almost exactly the opposite of a diet that is recommended by many people for this condition. And what happened? Quality of life improved and disease activity reduced. And of course, it's not just about putting the plants in, and it's not just about taking the processed stuff out. It's also about looking at your intake of animal products. I mean, we know that animal products are pro-inflammatory for so many reasons. You've got your heme iron, you've got your polycyclic aromatic hydrocarbons, you've got your HCAs, your IGF-1, you've got things like sodium nitrite and sodium nitrates that are used to cure like bacon and sausages and make them look pink and vibrant when they wouldn't really look like that if they didn't have these preservatives. And of course, we've got our carnitine and choline, which is turned into TMA, produces a pro-inflammatory gut microbiome. TMAO drives systemic inflammation. So it should be no surprise to us that increased intake of animal products is also linked to increased risks of Crohn's disease. I mentioned earlier how we used to think Crohn's was a genetic issue. We now know that diet and lifestyle are so important. One of the reasons we know that is because as the standard Western, standard American diet swept the globe, Crohn's disease swept the globe, just like obesity and heart disease swept the globe. So in Japan, for example, when they made the switch from a traditional Japanese diet to a kind of standard Western diet, suddenly Crohn's disease started appearing. So a group of researchers in the 1990s in Japan looked back over rates of Crohn's disease in areas of Japan over a 20-year period. And they tracked dietary change versus incidence of Crohn's disease. And what they found was that the more animal protein and milk protein and total fat that areas were consuming, there was an increased risk of developing Crohn's disease. And the more plant protein that areas were consuming, which is a marker for eating more plants, the less Crohn's disease. So that's a big clue. We've seen similar studies closer to home for me coming out of France. If you eat 2 grams per kilogram body weight of animal protein per day, which is a reasonably high amount of meat, you are tripling your risk of developing Crohn's disease. Whereas if you eat more plants, you're reducing your risk. And it's, we talked about all these pro-inflammatory properties of animal products. Let's not forget the gut microbiome. There's a really famous microbiome study done out of Harvard back in 2014. I'm sure multiple of your guests will have mentioned it. The title of the paper was, I believe, it's Diet Rapidly and Reproducibly Induces Changes in the Human Gut Microbiome. And they took a group of healthy volunteers, I think they were university students, and just for 4 days, they put them on an animal-based diet. This was a few years before the carnivore diet became popular, but that's essentially what they were on. They were having meat and cheese and bacon and eggs all day long. Within days, they saw dramatic changes in the gut microbiome. They saw the increased abundance of these bacteria that are capable of triggering gut inflammation. And they weren't a team of IBD researchers, but they suddenly said, hey, look, this is another reason to explain why increased intake of animal fats and animal protein and saturated fats and cholesterol is linked to increased risk of chronic gut inflammation, because you're inducing these unfavorable changes in your gut microbiome. So
animal products in general, but in dairy in particular, isn't that very bad for the gut?
Well, there's two issues in the context of this condition. Number one, there is the dairy fat, which is so dairy fat intake is an independent predictor of developing inflammatory bowel disease, probably mostly due to the pro-inflammatory effects it induces in the gut microbiome. And then, of course, that's the fat, and then you've got the lactose, the sugar. And many people are intolerant to lactose. Most people on planet Earth are intolerant to lactose. When I'm explaining this to my patients in clinic, I start telling them about the science, and then I just say, milk is for babies. And then they get it. Milk is for babies. Grown-ups don't need milk.
Absolutely. I imagine there's probably parts of the world where Crohn's disease doesn't exist.
There are parts of the world where the dietary habits have not been westernized or Americanized. And yes, the rates of Crohn's disease are far lower.
Have you had patients change their diet and have improvement with their Crohn's disease or other GI conditions?
Very much so. So at my clinic, AJ, I ask every patient 3 questions when I meet them. How many servings of fruit do you eat a day? How many servings of vegetables do you eat every day? And how many servings of whole grains do you eat every day? And that's a really good starting point for further conversations. Because if the person says 3 servings of fruit and veg, 3 servings of whole grains, then we're already doing okay, and then maybe we can move on to dairy and processed meat and processed food. But if they say, oh, I don't like fruit, I have vegetables at the weekend, and what exactly do you mean when you say whole grain, which unfortunately is often the answer I get because people have been raised with the standard Western diet, then that's where we start working. That's where we start. But many of my patients who have made the kind of more plant-focused changes in their diet have done really well. Many of my patients who have gone, the full way to a completely whole food plant-based diet have really turned things around. And that absolutely makes sense, because we've seen the studies showing that a whole food plant-based diet not only reduces the inflammation in inflammatory bowel disease, but it also helps people to get into remission. It helps the medication to work. So nice study done, I think about 2 years ago, showing that, I talked about these fancy new drugs we have, and infliximabs and adalimumabs and all these. They'll get maybe between 30 and 50% of people into remission. They'll get maybe 60 or 70% of people a bit better, quite a lot better. But they don't get most people into remission. But if we combine those drugs with a whole food plant-based diet or close to it, we can get those remission rates up to like 94%. So over the years, because I've been reading all these studies about the role of diet in inflammatory bowel disease, I could say to patients in my clinic, I would like you to switch to a diet that restricts animal protein and animal fat and dairy and emulsifiers and all food additives, whilst providing or increasing your intake of dietary fiber. But instead, I just say, I would like you to eat a whole food plant-based diet, because it's the same thing. It's the same thing. And the further they can get towards that, the better. I'll put a caveat on that though. For patients with milder disease, making that change, you can use any plant-based cookbook, any plant-based program. You could do like the PCRM 21-day kickstart pro, whatever. Just go out and get yourself a really good plant-based cookbook and start making some changes. But often patients with Crohn's disease already have significant sections of their gut that are permanently damaged and are going to be permanently dysfunctional. Many patients with Crohn's disease may already have part of their bowel removed. They may have had resections. They may have stoma bags, AJ. They may have had other reconstructive surgery. So for many of my patients who are in that situation, making those changes often requires the individual support of a dietitian who knows what they're talking about.
Right. How did you come to this information, and do any of your colleagues support you?
Well, the really interesting thing is that this information that I've been talking to you about is really entering the mainstream in gastrointestinal research and gastroenterology in general. And we're seeing papers being presented at mainstream medical conferences and in the journals. So I mentioned earlier this paper published a few weeks ago showing the impact of diet in ulcerative colitis. So the title of that paper was Low Fat, High Fiber Diet Reduces Markers of Inflammation and Dysbiosis and Improves Quality of Life in Patients with Ulcerative Colitis. Now that was published in CGH, Clinical Gastroenterology and Hepatology, which is like one of our very mainstream prestigious journals. So whereas 3 or 4 years ago, I was kind of pulling research out of journals that maybe my colleagues may not have read. In the last few years, we are seeing this stuff very, very firmly in the mainstream. And in fact, for any of your viewers who have Crohn's disease and who feel that their GI team just aren't up to date with the research, so AJ, I'll give you like 3 or 4 links that maybe you can put alongside this video module. So they can just hit those links, they'll find some papers, and they can literally forward those links to their GI or to their IBD dietitian and say, look, here's some evidence that please support me, help me to make these positive changes.
That would be incredible. We'd appreciate it so much, because it's interesting how so many doctors in general, and even GI doctors in particular, say that diet has nothing to do with the diseases these patients are getting. And with the GI tract, there's so many places that things can go wrong, from reflux, which is up here, to hemorrhoids, which are down there, and everywhere in between.
Everything in between, absolutely.
Right.
And our patients know that food is important. They ask us, every single patient with a gut health issue will ask their doctor about food. And I think we've got this responsibility, because we know that if we don't give our patients evidence-based answers, and we are clinicians, we are scientists, we are trained to look at the evidence and interpret it. We're trained to look at the evidence and see if it's clinically useful. If someone does a study that says taking a certain dietary supplement has this impact, we have the ability to look at that and go, okay, I see what they're talking about there, but that's not going to make a difference to someone with Crohn's disease. That's not a significant impact. I'm not going to recommend that. Whereas we may look at another paper and go, yes, they have demonstrated definitively that this intervention is going to help. Then we can recommend that intervention. Just like we look at the evidence before we recommend a drug or surgery, we can look at those papers in the same mainstream medical journals, and we can bring these things into our clinical practice.
Would you say that the largely fiberless, high animal product diet is a culprit in almost all of the GI diseases, regardless of where it's affecting the person?
Well, one of the things, I mean, for me, the thing that brought me to recommending a whole food plant-based diet was my patients asking me questions, and then I would go and look for evidence. And over the years, it became, look, get rid of the processed food, then get rid of the animal products, and eat more fruits and vegetables. And I eventually found myself recommending a whole food plant-based diet. But you can't read the research, because so many of the kind of pro-inflammatory and damaging mechanisms are shared. Not just, these things don't just cause Crohn's disease or ulcerative colitis. They're also the same processes that lead to things like colorectal cancer and polyps, diverticular disease, hemorrhoids, hiatus hernia, acid reflux, esophageal cancer, and even beyond the gut. They are the same mechanisms that can increase the risk of obesity and type 2 diabetes and heart disease. And we know that when we're treating patients with inflammatory bowel disease, we should know as clinicians, because they're coming to us, we are their doctors, we got to look beyond the gut. Patients with inflammatory bowel disease have a significant excess risk of heart disease. So we got to be thinking about that when we see our patients. Young people, there's a really interesting study done in the US a couple of years ago, huge number of patients, I think maybe over 10 million people involved in the study. And what they found was that young people with inflammatory bowel disease, up to 4% of patients under the age of 30 with inflammatory bowel disease had had an MI, had had a heart attack. So we need to be, you talked earlier about how so many doctors recommend reducing fiber, and often that's junk food, right? So yeah, eat junk food, don't eat any fiber, eat lots of meat, don't eat any fiber, it'll help reduce your bowel action. So those foods are going to increase the risk of heart disease even more. It's already a pro-inflammatory, pro-atherogenic condition. And if we tell people to eat crap food, we are doing them no favor. If that dietary recommendation was a pill, I don't think it would get FDA approval.
Oh, I love that. That's great. The last sentence you said, I'm going to write that down. That could be a great t-shirt too, as well.
Yes.
So one of the conditions, and we haven't talked about it yet on this summit, but I know a lot of people that suffer with it. And again, it's embarrassing and you can't even spell it. And that's hemorrhoids. At least I don't, I never know how to spell that word.
Yeah. So hemorrhoids are these we have this little venous supply of blood, or these veins low down in our rectum. When we do a camera test to examine inside someone's bowel, as soon as we go in through the anus into the bottom, the first thing we hit is hemorrhoids. So they're these little cushions, these filled up blood vessels that are full of blood, and they occasionally leak and you see blood coming out. Or if they get big enough, what happens is when you sit down to poop and you're pushing the poop out, you're pushing these blood vessels out as well. They get bigger, they get larger, they stick out of your bottom, they become unsightly, unpleasant, and uncomfortable. There's great treatments available for them. You can have, topical creams to reduce them. You can have like a little mini surgery to remove them completely. But we know that in societies where people eat a lot of fiber, they don't get hemorrhoids because they never strain to open their bowels.
Right. Yeah, that's interesting because I talk to a lot of people, even people that are vegan, that still are constipated and still are straining and are, have some of these conditions.
I have to say, my own, having looked at this research for years, my own belief is that humans are designed to eat a lot of fiber. The more fiber, the better. It's not achievable for everybody. We are so far from our ancestral diet that it's very difficult for people. But, I was reading some research recently, AJ, and this is going to sound like a little bit off-piste, but on Western lowland gorillas, okay? Western lowland gorillas in Africa, in the Congolese jungle, they share like 98% of their genetics with humans. They look human. Their digestive tract looks human. They spend their days eating. They are gatherers. They eat a whole food, plant-based diet. They eat hundreds of different types of plants, and they're consuming hundreds of grams of fiber per day. Do they get gas? Nobody knows because they live outdoors, okay? And so, nobody complains when they have gas. Do they need to rush to use the bathroom? Nobody knows. They're outdoors all day. They don't need a bathroom, but they eat a tremendous amount of fiber.
That's what all the experts are saying. Fiber is really the magic key, and it's missing in so many people's diets. What is diverticulosis and diverticulitis? Because that's something I hear that a lot of people have. And is that preventable and reversible?
Well, I don't know about reversible, but it's certainly preventable. So diverticulosis in the lining of our bowel, particularly over on the left-hand side of the bowel, where it's starting to get close to the outside world, the tube gets a little bit narrower, and because it has these kind of built-in areas in the lining of the bowel, which are a little bit weak because there's veins running through them. So there's sort of weaknesses in the wall of the tube. So if the pressure in that tube is high due to firm stool and straining, then over years, those little pressure points become little defects in the wall, like little pouches popping out in all different directions. And over the years, as those pouches become more pronounced, suddenly instead of looking like a tube, the tube that your bowel movements move through looks like that, with lots and lots of pouches and holes. And when we try to do a colonoscopy to look through the tube, it's like a labyrinth. It's difficult to know which way to go with the tube. And that can lead to inflammation, reduced blood supply, the mucosa becomes red and sore, and sometimes those pouches can get clogged up with a firm stool, and then, you know, tons of bacteria grow and it's red and sore and needs antibiotics. But we know, I mean, in the 1970s, the legendary Dr. Dennis Burkitt, the UK surgeon, who, by the way, trained in Dublin in Ireland, near where I'm from, so the legendary surgeon, Dr. Dennis Burkitt, who'd been working as a young surgeon in central London, and then went out during World War II to work in rural Africa, and then after World War II returned to rural Africa to work in mission hospitals and dedicated much of his career to doing that important work. One of the things he noticed immediately was when he was on call overnight in the UK, he was getting out of bed to operate on people with diverticular perforations all the time. When he was living in rural Africa, he never got called out of bed to operate on someone who had perforated a diverticulum in their bowel, because it just wasn't there, because people were eating this traditional high fiber diet, so they weren't getting diverticular disease. It's incredibly common in my part of the world and in your part of the world. Your risk of having diverticular disease is approximately your age minus 10. So about 50% of 60-year-olds, about 40% of 50-year-olds have diverticular disease. And if you're 90, you almost certainly have diverticular disease if you're eating a standard Western diet.
And people that have it say they can't eat certain plants, things like nuts or beans, things that aggravate that condition.
I think there's a lot of sort of misinformation out there. Certainly, I've seen many patients with diverticular disease making the transition to a healthier, more plant-based, more plant-focused diet. And, you know, for some people, like all things, making this change may be a gradual thing. So you start with your breakfasts, then you move on to your lunches, then you move on to your evening meals over a period of time. And, you know, I know, and AJ, I'm sure you'll recognize this, that for a lot of people, even despite the evidence and despite the recommendations of people like me, despite the recommendations of the American Heart Association, that whether you're choosing to reduce meat in your diet or eliminate it completely, it's likely to improve your health. Despite the fact that the official recommendations in the US now for the treatment of type 2 diabetes recommend first line a whole food plant-based diet to achieve an optimal body weight and improve your sensitivity to insulin. Despite all that, conceptually, for many people, they will never make the transition to a completely whole food plant-based diet. But the closer they can get to it, the better.
Right. But still, many people would rather take a pill for every ill and take a fiber supplement than rather eat a fruit or a vegetable.
That's what cracks me up. The fiber supplement industry in your country is worth billions.
Yeah, it's, you know, you mentioned an important word, gradual. And I think what happens with all of these GI conditions, it didn't happen overnight. The insult was over a long period. And then once they get to a point of wanting help, they want to feel well right away. And it doesn't work that way. Like somebody that's been overweight a long time, instead of, you know, going on a dietary lifestyle change, they'll have maybe gastric bypass to see results quickly. With the GI tract, it doesn't work like that.
It doesn't work like that, but I mean, there are certain benefits you're going to see really quickly. Earlier this year, we ran a little project that you and I have spoken about before, where we took 100 health professionals, we put them on a whole food plant-based diet. They were all eating a kind of a slightly healthier version of the standard British, standard American, standard Western diet, but a third of them had hypertension, a third had hypercholesterolemia, and a third were overweight or obese. And in just 28 days, we saw people dropping weight, reversing their high blood pressure, and dramatically improving their cholesterol. But you can do that in 28 days. But you're right, it can take up some time for your gut to adjust to this new, healthier approach to eating. So most people, I really think, should be able to jump right in and make that change. Get a good cookbook, sign up to one of your courses, get one of your cookbooks, get stuck in. And you can do it overnight. But for a lot of people, I agree that doing the transition more gradually gives you, your kitchen, your family, and your gut microbiome a little bit of time to adapt to your new, healthier approach to food.
Right. I think a lot of people, that at least when I hear the symptoms that they just don't like and they associate with eating a lot of fiber, gas, bloating, and distension, especially distension, because people, you look a certain way and it's again embarrassing. And so, well, then I better not eat fiber because I'm going to feel gassy and bloated.
I think so, but I genuinely think that most people who make the change don't run into that problem. But obviously, the people who do will let us know about it, and we need to have an answer. We need to be able to help them and support them, and maybe taking a step back and taking a gradual change. We've spoken before about the Happy Gut course, which is an online course that I run with my friends Stephen and David Flynn. So we combine a transition to a healthy whole food plant-based diet with a low FODMAP approach. So we're taking out a lot of these fermentable components of healthy foods, which are good things. FODMAPs are a good thing. These are exactly the things that our gut microbiome thrives on. But we have designed a healthy whole food plant-based meal plan that runs over 6 weeks. So you can do it over 10 weeks if you want to take it even more slowly. But we gradually build back in the FODMAPs. And I think for people who've made the transition to a healthy whole food plant-based diet and are still experiencing some gas and winded distension, maybe their gut microbiome is suffering with certain high FODMAP foods. It might be onions, it might be garlic, it might be avocado, it might be certain fruits. And going through that process can be really helpful. You can learn a lot and come out the other end of it with vastly improved digestive health without having to give up your healthy whole food plant-based diet and all the benefits that come with it.
Just please, doctor, don't take onion away from me ever.
Oh,
I wouldn't survive. So I'm sure you're familiar with Dr. Esselstyn, and one of the things he says is heart disease need never exist, and if it exists, it need never progress. How much of the GI disease could you attribute that phrase to if people were to eat a high fiber, healthier diet?
Well, I think in common with heart disease, a lot of these gastrointestinal conditions we view as inevitable. They're so common now, we think it's just part of getting old. I'll give you an example. Colon cancer, large bowel cancer, incredibly prevalent. In the UK and the US, it affects about 1 in 15 women, about 1 in 13 men. My own family has been affected by this. I tell patients all the time, I sit down with people all the time, say, the colonoscopy I just did, I found a lump, it's cancer, we got to do something about it. Let's get on and do something about it. It affects 42,000 people a year right here in the UK, about 1 million people worldwide. But Cancer Research UK, mainstream research body, tells us that more than half of the cases of colorectal cancer that occur here in the UK are caused by one of 3 factors: obesity, insufficient fiber in one's diet, or too much meat in one's diet. That's 3 things that are completely preventable, cause more than half of the colorectal cancers here in the UK. Most of the remainder are caused by cigarettes and alcohol. So cigarettes, alcohol, not enough fruit in your diet, not enough vegetables in your diet, not enough whole grains in particular in your diet, too much meat, particularly red meat and processed meat. If we can get rid of all 7 of those things, we could reduce rates of colorectal cancer in the UK by 80, 90%. So the vast majority of these cases are completely preventable. There'll be many people out there who have a familial risk for colorectal cancer. Their mom or their dad had colon cancer, therefore they're in a screening program. And every few years they go to see their GI and have a colonoscopy. At my hospital, if you are in that group, you will get a glossy leaflet explaining how you can dramatically reduce your risk by making healthy diet and lifestyle changes, and explaining how the vast majority of cases are not genetic, they're not set in stone, and there's a ton you can do to reduce your risk.
Absolutely. And they're making the screening age younger and younger, which I think is important.
They have to, because our patients with colorectal cancer are getting younger and younger. So we are seeing younger and younger patients with colorectal cancer. It's not because human genetics have changed in the 20 years since I was in med school. It's because the diet is just getting worse and worse and worse.
I'd like to be able to reach some of the people before they have to see you.
That's so important. That is so important.
Yeah. You mentioned something, and I'm not sure what it is, so I'll ask, but I've heard it, hiatal hernia. How do people get these, and is this something that's easily preventable?
So when you eat food, it goes into your mouth, Then it goes into a long tube called the esophagus or food pipe, which is about 30 to 40 centimeters long. So that brings the food right by your lungs inside a tube, and it's got to get it down into your digestive tract in your tummy. So there's a big muscle that separates your chest cavity from your tummy cavity called the diaphragm. It helps you to breathe. It moves up and down when you breathe. There's a little hole in it that allows the esophagus to pass through so the food can get into your stomach. If that hole is too wide, the line between your esophagus and your stomach is also going to be really wide. So food can slip up and down. The acid in your stomach can slip up and down. And that can cause indigestion and heartburn and esophagitis, etc. And you'll end up probably being given a medication like omeprazole or lansoprazole, which is a whole other issue that we can talk about another time maybe. But it's incredibly common. It affects about 15 to 20% of people who have an endoscopy. But again, it's another one of those conditions, AJ, that Dr. Burkitt was writing about in the 1970s. We just don't see it in countries where people eat a healthy, high-fiber diet. And although I would imagine that many of these hiatal hernias are just the way people are put together, the little hole there it's designed to be a little bit too big than it ought to be. And I'm sure that that's an issue for people. But again, our kind of naturally fiber deficient diet and the amount of effort that we have to put in to defecate, which increases the pressure in the system, over the years, it's just pushing everything up.
Yeah, it almost seems like you need another course, Making Pooping Easy.
I like it. I like it. I like the title.
You know, it's funny because it's like when you mentioned how you can greatly reduce your risk for these cancers, even if you have a familial component. It's not even so much that the genes are genetic, or the disease is genetic. It's the way the people eat, the recipes.
It's sad that when people are informed that they have a genetic risk, that sometimes the advice they get from their doctor is, look, you got a genetic risk. There's nothing you can do about it. Just come in every year. We'll do your colonoscopy every 3 years. There's a lot you can do about it. Still have the screening colonoscopy. Don't get me wrong here. Screening colonoscopy is super important. It's a big part of my job. So I'm involved very heavily in our local screening program. But alongside the screening program, you've got to give the healthy dietary advice. And it's just, you mentioned Dr. Esselstyn earlier, it's the same with heart health, right? When we ran that challenge earlier this year, when we put 100 healthcare professionals on a plant-based diet, we had one lady who had a condition called familial hypercholesterolemia. So she's got a genetic issue where her cholesterol is always high. And she'd been told by her doctor, look, there's nothing you can do about it. You've got familial hypercholesterolemia. Your cholesterol level's always going to be high. Come in every year, we'll check it. Here's your statin. We'll up the statin if the number goes up. Nothing you can do about it. So she took part in our 4-week plan. We almost got her cholesterol into the normal range. Almost. Just a couple more little, if we could have got it maybe 2% lower, she would have had a normal, healthy cholesterol level. So what does that tell us? Just because we've inherited a genetic issue, doesn't mean you got to forget about the healthy diet and lifestyle. We still have so much to offer.
You mentioned that when you first started practicing medicine, these new class of drugs, these biologics were developed. And of course, there's always been steroids. Do you think the fact that they have drugs that will make people feel better sometimes makes it harder for them to change their behavior? Like, for example, with reflux, the proton pump inhibitors, those used to be by prescription only. Now you can get them over the counter. And I see a lot of people with gastroesophageal reflux disease take these so that they can eat, foods that would normally aggravate their condition.
I know, and I mean, in my practice, I think when we see patients with these conditions, we've got to mention food. I mean, it's more obvious for my specialty than it is for any specialty. So I get it that if you've got heart disease, you might be surprised potentially for your cardiologist to ask you if you have eggs for breakfast. If you have a lung disease or a chronic neurological condition, you might be surprised that your doctor's talking to you about food. But when you've got a GI condition, it should be part of every conversation you have with your healthcare practitioner. And of course, we know that in the UK, in the US, so in the United Kingdom, where I'm from Ireland, but I now live and work in the UK, we know that poor dietary choices cause more disease and disability than alcohol use and drug use combined. We know in the US that poor dietary choices cause more disease and disability than any other risk factor. Cigarettes, lack of exercise, poor air quality, road traffic accidents, et cetera, et cetera, et cetera. Poor dietary choices beat them all. And our patients aren't coming into us with a deficiency of a drug that they need to have prescribed. Although I prescribe a lot of medications, I'm not anti-medication. They definitely are important, but they're not coming into us with a drug deficiency. In many cases, they're coming into us with a condition that can be really helped by a healthy diet and lifestyle. And nobody's told them. They just haven't been given that power. They haven't been given that information.
Yeah. You had mentioned 7 things. You held up your fingers, and 2 of them were smoking and drinking. How does smoking and drinking affect a person's GI tract in general, and especially one with disease in particular?
Well, of course, when you smoke a cigarette, same with anything you take into your body, it's the same. I mean, when we talk about anti-inflammatory foods and diets that reduce systemic inflammation, it's not because those foods kind of rub up against the lining of your bowel and heal it. It's because they generate changes in your body and in your bloodstream which benefit your gut. So it's a systemic change. It's the same with cigarette intake. So if you smoke a cigarette, we know that you're inhaling all these horrid, cancer-causing, pro-inflammatory chemicals, but they don't just rub against your lungs and then get blown back out again. They enter your bloodstream and they enter every single cell in your body, which includes the lining cells of your gut. So cigarette smoking is a big risk factor for developing Crohn's disease, for example, also for developing colon cancer, but also for developing things like skin cancer and breast cancer. So, of course, these chemicals that we choose to take into our bodies affect the whole system.
Wow, that's amazing. So, Dr. Desmond, what is the truth about GI health?
The truth about GI health, what a great question. The truth about GI health is that the standard Western diet, which is a low plant, high processed food, high dairy food, high animal food diet, is perhaps the greatest challenge our digestive health has ever faced, but we can do something about it.
That is great. Thank you so much, Dr. Desmond.
No, thanks. Lovely to spend time with you as ever, AJ.